Welcome, my dear audience and friends, to another episode of Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I'd like to thank you guys ever so much for your continued support on this show, and also for the newbies to let you know that this show aims to demystify the cancer disease and to let experts and stakeholders in the cancer space to come give their take. So on this episode, my next amazing guest is an accomplished professional with so many years of corporate marketing, publishing, and partner project management. After 25 years working at the National Geographic, she is now a project manager at Inspire. Outside of work, she is into lots of advocacy concerning esophageal cancer, and she's also focused on healthcare advocacy and policy. Anyway, I'm not going to waste more time on that because she's going to tell you all about what she does herself. So, without much ado, let me welcome the inspiring Deighton to the show. Welcome, Dana, and so happy to have you on.
Thank you, Grace. Thanks for having me. I'm very excited to be here. It's nice to see you.
Same here. Thank you for coming once again. So please tell us a little bit about yourself, your background, please.
Well, you covered a lot of it, Grace. I have been, working since I finished my university degree back in 1992. And for the most part, that was at National Geographic Society, which was a great career, and it afforded me a lot of fantastic travel and exposure to different people and places. And towards the end of that career, there is when I actually started to not feel so well. And at the time, I had 3 young kids that were roughly 8, 10, and 12.
Mm-hmm.
And some things had changed at my place of work, so I actually wasn't working there anymore for a little while. And it was kind of good timing, even though that wasn't apparent right away.
Mm-hmm.
But the time off gave me the opportunity to actually spend some time figuring out why I didn't feel well and visiting some doctors and taking care of appointments and things like that. And that turned out to be a full-time job because the diagnostic journey actually was very complicated. And it took many months to figure out why not only I wasn't feeling well, because things were getting worse. It took a lot of exploration to dig into.
Wow. Oh my goodness. Okay, so now we had already discussed, and you are very much involved in esophageal cancer. What is it exactly?
So there are 2 types of esophageal cancer. One is squamous cell esophageal cancer, which I believe is more prevalent in certain demographics than others. And then the other is adenocarcinoma. Both of them can really be in any location in the esophagus, from the very top up near your throat where your swallowing function takes place, all the way down to the top of your stomach, which is called the distal esophagus. Mine was esophageal cancer adenocarcinoma, and that's a little bit more rare for people in my demographic, both for women that are younger, and even in this country, I believe. It's not a very prevalent disease in the first place. So the fact that I had it at my age and that type was extremely rare. I was only 43 at the time, and nobody suspected it. I also did not have any symptoms that usually go along with it, such as the trouble swallowing or the chronic heartburn or anything like that. I didn't have a chronic cough or anything. I just kind of didn't feel well in a vague but chronic way. And the most acute symptom that I could probably explain was this ringing in my stomach, and it actually felt like somebody had a washcloth, like a ringing, like if you take a washcloth and you try to wring the
like
in
knots, kind of.
Exactly. And it was pretty persistent, and it started after kind of after a dinner one night, and so I of course thought it was food poisoning. that was just coincidental, and it ended up persisting long after the dinner or long after any food poisoning would. And it also started to migrate not only to different parts of my stomach, but around to my back, sort of under the kidneys. And my symptoms, even though they were chronic, they were vague enough that nobody exactly knew what they might be. And so, people looked at irritable bowel syndrome and Crohn's disease, things like that. And interestingly enough, my mom had died of colon cancer. And so the first thought was, of course, that it might be a gastric cancer. However, they were only looking at gastric, like in the colon area. And I had already had a couple of colonoscopies even prior to not feeling well. But I did have one other, and they were all clear. There were no symptoms there that would have made sense with how I felt.
Yeah.
And I continued to feel quite fatigued and just not like myself. I couldn't really hang in there to do homework with my kids in the evening because I was just so uncomfortable sitting at the table. Sort of took all of my energy to stand up
Energy.
straight or to sit
Yeah.
up straight. And I woke up feeling tired. It was just extremely uncomfortable. And I had always been really active, so I wasn't used to that, that type of fatigue. So the next thing that happened, while all of that was being undiagnosed, I sort of reached up here and I was like, what am I going to do? I just feel so bad. And I felt this lump in my neck,
Oh,
and
wow.
I knew
You could
right.
actually feel it,
Oh
right?
yeah, it was about this big. It was like the size of a Brussels sprout.
Oh my goodness.
I don't know why I hadn't really noticed it like that before. It didn't hurt, but it was just there. And I knew that that was bad. I knew enough to know that it couldn't mean anything good. And so I went back to my primary care physician, and she ordered an ultrasound, which came back inconclusive, and then a fine needle biopsy, which came back inconclusive. And but all during that time, like, we knew that there was necrotic tissue. We just didn't know um, really what it pointed to. The biopsy from the fine needle biopsy and eventually the excision of the lymph node had so many different markers and indicators that I had oncologists guessing, well, is it, a GYN cancer? Is it lung cancer? Is it breast
Because
cancer?
it was rare. They'd never seen something like that before, right?
Right, exactly. And it was highly differentiated. That's what they call it, an inconclusive tissue. So they just didn't know what to do. So that actually was sort of like the second beginning of the diagnostic odyssey, where I had sort of every test in the book. Another colonoscopy, a breast MRI, a GYN exam that was like no other I had ever had. All with biopsies. I had lymph nodes taken from my abdominal area
Mm-hmm.
that were also biopsied, and they came back with different tissue suggestions as well.
Yes. So
So,
I wanted to find out something. You said because of this, you had to go for an
mhm.
OB-GYN. What is the correlation between, esophageal cancer and seeing a gynecologist for that?
Well, there normally would not be one, but I can give you sort of two not exact answers to that.
Mm-hmm.
So, because of the biopsies coming back from my cervical node and my abdominal lymph nodes,
Mm-hmm.
they had tumor markers in there that were sometimes consistent with GYN cancers, like ovarian cancer.
Okay.
Esophageal cancer can be related to or connected with an HPV cancer,
HPV. Okay.
which of course also can connect with a GYN cancer. It did not turn out
Absolutely.
that mine was HPV positive, but
Okay.
they were just chasing, kind of shots in the dark because
Mm-hmm.
nothing else was really showing, much promise.
Mm-hmm.
The other thing that I was going to mention, which sort of came about later, was that gastric cancers and GYN cancers can also be connected to Lynch syndrome, which is a hereditary cancer marker.
Yes.
That would have all made perfect sense given that my mom had colon cancer, except that when I was eventually tested for Lynch syndrome, which was long after my diagnosis,
Mm-hmm.
uh, it came back negative. So all of the things that sort of you might think could correlate never really did.
Yes. And for those, for anybody watching, what is Lynch syndrome, please?
Lynch syndrome is a hereditary marker for some cancers that include gastric and GYN cancers. I'm not a physician, so I can't really give you much detail
No.
more than that.
Yes. Yes.
But it's important that people are checked for Lynch syndrome because, from what I understand, you will have a higher prevalence of secondary cancers. And if you know about it ahead of time, you can be preemptive
Okay.
sometimes to avoid
Okay.
those.
Yes, yes. So it's best actually to check for everything, you know,
Absolutely. More
because
knowledge is power.
yes, more knowledge is power. And then also it's scary when you said you went for tests and they came back inconclusive because it happened to me too. I didn't have any symptoms to say I had breast cancer, you know.
Right. So it's scary how
It
that can happen.
Yes, it was a biopsy that, you know,
Hmm.
made them, reach that diagnosis that I had a mass, you know, and
Wow.
that was it. It was just a fall in the bathroom. So it's really good that there are
Wow.
options to find out about these things. If it's not a mammogram or it's not a PET scan, then you can, if nothing is found, then you can now go for biopsy, which would be able to be
For
more,
sure.
yes, sure. Oh, wow.
Absolutely. I don't think we're alone. I think this happens to a lot of people. And
Yes.
I think a lot of people get misdiagnosed sometimes. And in fact, before I finally had my final real diagnosis, I had physicians that were really willing to call it either a cancer of an unknown primary or a
Wow.
cancer of two primaries. And neither of those are good because you can't target medicine to the unknown. So
Yes.
you probably would even get, you know, lesser results.
Yes, yes. And there's no, what should I say, precedent to that for them to say, oh, they have a case of someone who probably had this, and then they would, take the same type of treatment and,
Exactly.
use it on you. Like breast cancer is common. Oh, okay, should be treated with taximofen or something. But
Exactly.
in your case, nobody was sure of what to do, and that
No,
must
in
have
fact,
been
they were
pretty
quite,
scary,
it
you know.
was really scary. And in fact, the endoscopy, which proved the diagnosis, or not even proved, it actually, what's the word I'm looking for? It presented the
Mhm.
diagnosis.
Mhm.
It was the very last test I had done, and that's because nobody ever really thought that that could be the case. So it was sort of like a last ditch effort to find it. Um,
Yes.
so
Oh, I'm so sorry about that. So please walk us through your interventions. After the diagnosis, what then transpired?
Well, because I was already stage 4, which
Oh,
is
wow.
why, right. So that's why I had the cervical node that was metastatic, as well as that answered the question as to why my tummy bothered me with that ringing sensation. It was basically metastatic perinatal
Oh,
I can't say
wow.
that word, lymph nodes in my stomach, and they were sort of strangling my intestines, and that's what caused the discomfort. So at stage 4, usually there are very few options for esophageal cancer in any patient. And the first best option is to get on systemic chemo because you have to, reduce the tumor burden quickly in order to figure out what to do next. And most people don't ever make it to a next because once esophageal cancer, like a few other cancers, are metastatic, it's really pervasive and it's really hard to tackle.
Mm-hmm.
I was lucky though. The chemo worked beautifully. I was very responsive. I tolerated it well, which allowed me to have even additional doses. It was still hard. It was not fun. And
Yes.
I'm just grateful that it worked. And I sometimes believe that those extra doses sort of were what really did the trick. And I had such consequential reduction in tumor burden that it did give me the opportunity to find a radiation oncologist that was willing to go to the next step and treat me with radiation therapy. And I believe that that helped, and it did.
Mm-hmm.
And from there, I was able to move on to surgery, which was an esophagectomy. And then that was followed up by more chemo and more radiation. And I actually did have a recurrence because
Oh, you
esophageal
did?
cancer.
Oh,
I did,
really?
and it's not uncommon for people with esophageal cancer. It's very tricky and mysterious, and it just pops up. And I'm one of the few people I know that has survived a recurrence. I have a network of people, like I'm sure you do, and
Mm-hmm.
it's very humbling sometimes to be where I am, and know that other people didn't have the opportunity or the good fortune that I
Yes.
did.
Yes.
So I'm very grateful for that.
Obviously. Oh, yes. Oh, definitely. Well, we are very grateful. Now, when you spoke about chemo, trying to reduce the tumor burden,
Mhm.
and you had to go through radiation, was it your neck that was targeted during radiation, or what was it? Since you had these tumors in your stomach.
Yeah, so the chemo actually did a great job in clearing up the metastases in my neck and my abdomen. And then knowing that the primary was in my lower esophagus,
Mhm.
that's what the radiation was targeted
Targeted.
to.
Okay. Okay, okay. Just to, understand where, because stage 4 meant that they were all over the place, so to speak, as you
Exactly,
said. And so
exactly.
there would have been different measures taken to try to, um, kind
You're
of
absolutely right.
contain
And
that.
that's why the chemo was so important first, because you can't radiate your whole body and you have to have a singular target for that.
Yeah.
And so the idea with the chemo was to clear up the metastases as best as they could and
Hmm.
then target the primary, because if you don't tackle the primary, it's going
Hmm.
to keep basically spreading cancer.
Yes. Yes.
I was really lucky that I was able to have radiation. Most people that are stage 4 never even get that far. So I did receive the radiation. I think it was a 45-day series, and it was accompanied by additional chemo as well. And
Hmm.
that part wasn't as hard for me. That was much easier than the stronger chemo by itself.
Yes, obviously. Oh, wow. So, sorry about that, Dana, but obviously, I mean, you look amazing.
Thank you.
Touch
You do
wood,
too.
having gone through all
Absolutely.
that, you know. Um, During this period, what was your emotional health like? I mean, um, for someone like me, because of what I was going through, they had asked if I would need some kind of psychosocial support and all that, which I
Hmm.
didn't actually, because thankfully I had a good caregiver, and my medical team were reassuring. But did you have any psychosocial support?
Not really. I'm happy for you that you had that, and I was fortunate in the same way. Really strong, great family, and an army of friends and
Yes.
neighbors that helped.
Hmm.
So I was really lucky, but that doesn't mean it wasn't hard, as I'm
Yes.
sure you experienced too.
Yes.
Sometimes, being the one with the illness, it can feel quite lonely, and it's hard to understand sometimes,
Hmm.
like um, just kind of how to move through the day. Unless
Yes.
you can speak with somebody that's in the same position, it's hard to relate to people that don't have it.
Exactly. And you spoke about doing homework with your children
Mm.
earlier. How did they, of course, obviously they were quite young at this time, but
They
they must
were.
have sensed that, kids, you can't trick them these days.
You
Did
are
they
so
sense
right.
anything? Did they know something was wrong? How did?
Well, the diagnosis was so dire when I finally got the right one. And I was told that I had about 10 to 12 months to live, that my physicians, really urged me to spend time with my family and get my affairs in order. And of course, that's not what anybody wants to here. And I really had no reason. I mean, even though I was determined to beat it, I didn't have any good reason to think I would, based on what my physicians were saying. And so my husband and I decided to face this pretty much head on with the
Mhm.
kids and let them know that it was, a very serious diagnosis. And when you're
Mhm.
8, 10, and 12, that doesn't necessarily mean a lot. But I mean, they understood enough, and I'm so proud of them, because I really truly believe that it's taught them to be, emotionally supportive of people that are going through any situation. And they're so empathetic now. And I'm just really proud of how they handled it.
Yes, that's beautiful because that also happened to my daughter. They kind of mature with you, I mean, along the journey. And I love it because it actually helps encourage them and teach them empathy, which I always say they don't teach at
Absolutely.
school anymore. They don't teach at school at
They,
all, you know.
you are so right.
Yeah,
Yes.
empathy is as a result of experiences, so
Mm-hmm.
it,
Absolutely.
it is a good it was some kind of, although it was tough, but it was good education for them, I think, in that
Yeah.
in
I mean,
that regard.
just like COVID has brought silver linings, sometimes so
Yes.
does a serious diagnosis. It
Hmm.
brings out the best in people as well.
Absolutely. Absolutely. Oh, Dana, that's nice. So going forward, how have you been able to use this experience to go forward? I mean, you're doing a lot of stuff at Inspire. Inspire is a fantastic place to be at.
I love it.
Yeah. So please let's know what's your driving force, what's your motivation, and actually what you do at Inspire.
So, the reason I'm here is because I don't think that I would have survived my situation without the help of others and without other people willing to make connections or give me advice, based on their situation.
Hmm.
And there were very few people that I could find that, were stage 4 esophageal cancer survivors, almost none that were in my age group. Most of the people were older men that were like 65 and above, and they just really didn't have the same lifestyle that I did.
Hmm.
And once in a while, I would stumble upon someone who had a stage 4 diagnosis, even if it wasn't esophageal cancer. And I could ask them questions about, what did you talk to your doctor about? Or did you try concurrent radiation and chemo or whatever it was? And I just
Yeah.
found that the more people that you speak to, the better armed you are to ask questions of your physicians. And those questions are what keep the dialogue going, and they help let your doctors know that you are there to fight. And I think that makes a big difference. But connectivity is really an essential element of human life. And whether it's a good day or a bad day,
Hmm.
humans need some sort of connection. And when you're in a situation with a diagnosis like this, it can really give you a reason to wake up the next day. It
Yes.
really can. And that's what it did for me, because there were some really dark days. And sometimes just speaking to somebody who gave me an idea or a question to ask that I had not asked before made me think maybe this will open one door that hasn't been opened yet. And in many cases, it did. And I'm so thankful to them. And now I really try to pass that along, because I know how dark some days can be and how scary they can be. And I have patients call me all the time now. And if I can just give them like one little glimmer and one
Hmm.
little idea to help them along, I'm more than happy to do it. Um, so going back to, my career, like I said, I love National Geographic, but it had been going through some changes itself. And I took a leave of absence. Basically, I went back to it for a little while after my treatment was underway. And they were still good years, but as I was progressing through my many years of treatment, it occurred to me I really wanted to give back in a bigger way.
Hmm.
And I started to look for opportunities. And I thought, gosh, without a medical background, either in nursing or, as a physician or a social worker, it's going to be hard. But I
Yes.
stumbled upon Inspire, and that turned out to be just magical to me, because I realized that several years before, when I was diagnosed, I had found Inspire as a patient. And I realized the beauty of Inspire then, that by allowing patients to connect and talk about their own experiences, people might be able to improve their own situation. And I started to do the research, and I found out where they were, and I found a few people that worked there. and decided that that's the
Yeah.
place that I want it to be, and I
Mhm.
pursued it, and I just love what we do.
Absolutely. And you guys are doing, I follow you guys. So you guys are doing an amazing, amazing job.
Oh,
Wonderful
thanks,
team.
Grace.
And it's there's nothing like community really, and I found that out quite late. Like I tell people that I'm not I in the early days when I was going through my mess, I didn't practice what I was preaching,
Right,
because
right.
now I preach community and carrying everybody along. But then I wanted to be by myself on my own and just face the demon, you understand, and not have
Absolutely.
a pity party, which would have made things worse. So
Absolutely.
there's nothing like community, and thanks to you and all the others at Inspire for the good
Well,
work
thank you. I
that
will
you
certainly
guys do.
pass that along. I really do believe that community has the power to heal and to improve outcomes every day. And
Yes, indeed.
again, like just making that one connection might be all it takes to
Mhm.
sort of have a better day.
Yes, indeed. So I know we're short for time, but we still have like about two, three things I'd
Sure.
like to ask of you. Is there anything you wish you had known then that you do know now?
Well, I think, I was always pretty driven to be my own advocate. But it's sort of on the job training with something like this. And so you can't know it all at the beginning, but by learning on the job and also speaking with other patients and caregivers and care teams, you can learn very quickly like where to look for resources and where to look for answers and how to understand clinical trials and all kinds of things. It's just, you have to be on top of it quickly because sometimes there's not a lot of time.
Hmm.
So I would just say, be your own advocate. um, Obviously you want to trust your team, but that doesn't mean you shouldn't question your team too.
Yes, like I always say, no question is a silly question. All questions
Absolutely.
matter.
They do. And I always tell people, don't be afraid to ask the dumb questions, the gross questions, the embarrassing questions, because they're important to expose.
Yes, they're important to expose. And also, I think we as patients, we need to vent, we need to rant. And even if we're asking the same questions all the time, just for our medical team to say, okay, we understand where you're coming from, and not tell us that we've asked the same question 25 times.
Yep,
That kind of extends our hope, you understand, our positivity,
absolutely.
and sometimes our lives, because that's all sometimes what a patient wants to hear. Oh, it's going to be okay.
Absolutely.
Oh, yes, you asked the right question, even though we can really be a pain in the butt sometimes, but it's all worth it.
It's very worth it. And you just have to be brave enough to do it.
Absolutely. So, is there, I mean, from your point of view, is there anything you think you could suggest to improve the healthcare system here in the United States?
Well, there's a lot that I would improve. I'm not quite sure where I would start there. In my situation, I didn't fit neatly into a bucket where there, was a well-worn path to success. And I would say patients should challenge their care teams to really look at the patient and not the disease sometimes, because just because you have a diagnosis doesn't mean your situation and your biology isn't unique. And especially today, as science is showing us, you know, tumor markers and genomics and things like that really do matter, and they can change, what your condition is targeted with as far as medications go,
Hmm.
and they can change your outcome. So the more you know, the better. And I would ask for genetic testing, and I would ask for, as many different types of analyses as you possibly can get, because that information um, often does, it shows how your situation might be unique,
Absolutely, you're so
could be
right
more
about
hopeful for
that.
you.
Yes, yes. So, the patients and caregivers, because a lot of times the patients don't even know what's happening. It's the caregivers that are there to ask those questions, to take notes,
Absolutely.
and all that, and to keep asking those questions. Like you rightly said, a lot of these diseases are becoming rare now.
Yes.
So no two diseases, even if it's breast cancer, there's the metastatic breast cancer. There's so many types of breast cancers now. DCI, estrogen positive, estrogen minus. It's
Yes.
crazy, and a lot actually depends on how accelerated the growth of the tumor can be, and
That is so true.
that is tied to hormones as well. So yeah, that's
That's very
fantastic.
important.
Very, very
Yeah, so thank you for
important.
asking that. I think
Yeah.
it's important to really encourage patients and caregivers to ask all of the questions and, always ask, is there anything else? Is there something we're missing? And to do their own
Yeah.
research. And that way they can ask questions to keep the conversations going.
Yes, and not to feel overwhelmed or feel as if they don't want to, because a lot of when I meet other patients, they say, "Oh, but we're scared to ask the doctor. He's already said so much. We don't want to
Right.
bother him." But I'm like, it's your body.
That's
You
that's
have
their
to
job.
ask. It's their job, and they have to tell you exactly, and then get
Absolutely.
other opinions.
That's
Um,
another thing, I mean, that's why they are scientists. They want to examine all of that information, but there's an art to medicine too. And I think that's the important thing to remember, that everybody is unique. And that's where a more nuanced approach can be very meaningful. And the
mhm.
art of medicine can be very important in those unique situations.
Yes, indeed. You're absolutely right. Thank you so much for that. So, what's your mantra? If you'd like to share to that person or viewer that be watching, because I know that you're very, very focused on the power of, connection and purpose to overcome, whatever we face in life and all that. What would you say to that patient?
I would just say stay focused and get up with a purpose every day. Know that it's a new day,
Hmm.
and believe in the power of connection, and be grateful every day. Be grateful because it is a gift. I know that sounds cliche, but truly, it does pay off, and it never hurts to pay it forward either.
Thank you so much, Dana. It's been such a pleasure to have you. And how can the viewers reach you? Even though I'm going to put your details on my show in my show notes for them to contact you.
Certainly, they can find me at Dana Dayton on LinkedIn or at Inspire.
All right. Definitely. I'll put that on. Okay.
Okay. Thank you, Grace, for this
Thank you so much,
opportunity.
Dana. Let me sign out and then I'll sign you out formally. Okay.
Okay. Thank you.
All right. So, my dear audience and friends, there you have it. You've been listening to my wonderful conversation with Dana Deighton, who has been able to tell us how she's overcome her challenges using the power of, connection and purpose to surmount her challenges. She's doing a fantastic job as regards advocacy, and you'll be hearing much about her in my show notes in the next episode. So, her takeaways are: be your own advocate and ask as many questions as you need to. Never take no for an answer. All right? So, guys, this is Grace B signing out. See you in the next episode. Don't forget to like, subscribe, and share. Ciao, ciao. Thank you, Dana. Blessings to you and your family.
Same to you, Grace. Thank you so much.
Thank you for coming. Bye-bye.
Bye.
Bye.